Dr. Zhang Shokwan, Head of Communicable Disease Branch, Center for Health Protection, and Dr. Larry Lee, Chief Manager of the Hospital Authority. Dr. Zhang will tell us the details about the cases. Good afternoon. Last night we reported 7 cases. Case numbers 13047 to 13053. 3 cases are imported cases. They were all caught on arrival at the airport. 4 cases are local cases. Among the 7 cases, 1 carries the L452R strain and 5 carry N501Y and D478K strains. For the other patients, the viral load is too low to be tested or analyzed. The 4 local cases include 13047, the case mentioned yesterday, the lady who works at a pet shop. She lives at Tongxing Road, Aberdeen, which was subject to restriction and testing last night. This morning, together with AFCD colleagues, we went to the pet shop where she works and gathered environmental samples to see whether the pets would be carriers of the virus. The genome sequencing for the lady, the Polytechnics University has given us a preliminary result. The viral carries a delta AY1 at 0.127. No matches have been found yet. The closest case is the case of the Pakistani male from the Middle East. Still, there is a substantial difference. There are 17 SMPs difference. So no source has been found yet. 3 cases are related to local case. 13501, 052, and 053. These 3 cases are identified at quarantine center. They are a family. That's the family member of the 19-year-old male, case 13014. One of the family members has met with case 12913. We didn't know that when we found the patient. Now all 3 family members are confirmed. 13051, a 17-year-old male. He studies at North Point Soji Gonghok Primary 5. He last attended school on the 7th, and then he stayed at home. On the 9th, he was tested negative. Now he is in the quarantine center, and he is tested positive. 13052, an 11-year-old girl. She studies at Hennessy Road Government Primary School, a Primary 5 student. She last attended school on the 12th. Besides going to school, she mostly stayed at home. She went to a tutor school on Lockhart Road together with her classmates. The classmates at the tutorial center will be subject to quarantine to testing. On the 9th, she was tested negative. The other case, 13053, a 46-year-old female. She is a foreign domestic helper. She mostly stays at home. She went to the home of 13014, the other case, at Yao Tong. Together with the employer to do cleaning work. So these are all related cases. And also last night at the Silker Sea View Hotel, we collected some samples, some 60 samples. Some positive cases have been found. Some reports are still pending. From the air purifier in front of room 413, we have found some positive samples, and also at the ventilator in the toilet. and also the faucet in the toilet. We have some preliminary cases as well. That's the other family member of the family I mentioned about. They all live at Coral Court. They have been subject to compulsory testing before. The public health laboratories whole genome sequencing review that the two security officers at Penny's Bay, the results are very similar. They are related cases as a result. They share the same source of infection. We have fewer than 20 preliminary positive cases, including the other family member of the infected family I mentioned above, and 9 cases they are the family members of the patient who was tested positive on the 26th day, including 5 household family members and 4 family members. When the patient returned to Hong Kong, there was also a child. They shared the same room. The child is not a patient. On the 10th, when they completed the quarantine, the child was sent to another family. That's why they have met. The other 4 persons are also quarantined, tested preliminary positive, plus the 5 family household members, altogether 9. The 4 persons lived at Po Wah House at Yun Chau Street, Sham Shui Po. Now, Dr. Lee, please tell us about the hospital authority situation. As at 9 a.m. this morning, in the past 24 hours, we have reported 19 cases. As at 9 a.m., 23 patients have been discharged in the past 24 hours. 12,416 patients have been discharged. 376 patients are being treated at the North Lantau Infection Control Center, the Hospital Authorities Infection Control Center, and the AWE Treatment Facility. All 376 patients are stable. That's all for my report today. Now we open the floor for questions. Please raise your hands and use our microphone. Please identify your media organization first. The lady in the front.
Good afternoon. I'm from Hong Kong 01. Well, for the close contacts, the quarantine period has been reduced to 14 days. But then with regard to Whitman Ho's birthday party, so for those who have been quarantined, including Jasper Choi and so on, so does that mean that they can leave by midnight today? And also for these people who have been tested, so does that mean that they have been tested negative on several occasions already? And also for those who stayed at the Silka Hotel, all right, it's suspected that there would be this spread within the hotel. So is it confined to the 12th and also the 4th floor? And also for those cases on those 2 floors, what's the whole genome sequencing? And also for the 11-year-old case, well, when she attended tutorial class, so which tutorial center was that? And also how many people have to be quarantined because of that, and how many have been sent to the quarantine center? And also for that particular cluster, well, it said that there was contact with 12913. So can you provide further details so that we can follow up on that? Well, for the tutorial class, that's from 2 to 6 p.m. On the 11th, and is called Tong Sam Tutorial School. Is Kids Smart. So mainly she was with her classmates, and because she's quite grown up, and she was wearing a face mask, and therefore there was no need for those classmates to go to the quarantine center. And we are now making arrangements for those who have undergone quarantine for 14 days to be released so long as they have been tested negative, so that they will be able to leave the quarantine center in an orderly manner. As to the specific details of the individuals, I don't have them with me. With regard to Silka Seaview Hotel, earlier on the 4th floor, the CHP's laboratory has already done the whole genome sequencing, and basically they are almost identical. And then for the 12th floor, well, the PolyU has conducted an initial whole genome sequencing, and it's very similar. But then there was an individual whose virus load is not that high, and therefore the sequencing cannot be done completely, and therefore we will have to do another round of whole genome sequencing before we can have the final result. As to one of the confirmed cases today is a 46-year-old female, and she's a foreign domestic helper. She mainly stays home. And then for 12913 on repeated occasions, she's been to this household, and she did have contact with 12913. So that's the reason. And that might have been the reason why she was infected. Sorry, she's not speaking to the mic. Sorry, speaker is not speaking to the mic. Well, I understand that gradually they are making such arrangements. And of course, they will have to stay through the 14-day period, and they will have to be tested negative. As to when the individual can leave, I don't know. Next, last row, the second one in white. Well, hi, I'm from Now. With regard to the pet shop sales, all right, you said that there was still some difference in terms of the sequencing. So what about the genome sequencing? You haven't been able to identify the source. Have you made any projection? Does that mean that there are hidden transmission chain in a community, or is it that there have been some imported cases that have not been identified? And also you said that for the girl that went to the tutorial school, well, it said that she was there from 2 to 6 p.m. So it's quite an extended period of time. So what about the other students? How come her classmates do not have to go to the quarantine center? Would that become a loophole? And also, within the tutorial school, so have they consumed any food so that they would be taking off their surgical masks? Well, according to the PolyU's analysis, for the pet shop sales, the genome sequencing was delta AY 0.127, and then for delta AY 0.127, as far as we are aware, that might have to do with the Pakistan case. And for 12567, he's from Pakistan, but then the genome sequencing is somewhat different, and therefore it's not from the same source. As to this particular individual's source of infection, we are still doing the investigation. According to our initial understanding, for the tutorial class, it's very similar to going to a normal class. But then we will have to find out more, because normally for very small confined space with only a handful of people there, we would be taking that more seriously. But then if it's like a normal class, there is no difference from attending a normal class, and then there is no very close contact. Next, I'm from cable TV. Earlier on, for the 43-year-old female, she did not go out, but then for the 9 family members, did they also go out? So was there a risk of outbreak within the family? And also for the tutorial class student, well, for those attending the same class, how many were there? And you said that the class size was small, and therefore it's not a big problem. But then how many exactly were there within the same class? And also for that student, she also went to school. So what about her classmates? Do they have to go to quarantine? And also for the pet shop's confirmed case, that female sales, what about the source of infection? Does that have to do with the pet animals in the shop? Well, for the 43-year-old female, she did not go out at all. And then her family members did go out, because she was only tested positive recently. We do not have the details. With regard to the size of the tutorial class, I haven't got the details yet. And then for the two schools, well, they will have to suspend classes for 2 weeks, and then everybody will have to undergo testing mandatorily. And then normally for very small kids, for example, those attending kindergartens and also nurseries and so on, we are concerned about the risk of infection. And probably they would not be wearing the mask very properly, and therefore the classmates will have to undergo testing and quarantine. But then for larger kids, well, since they are more grown up, and therefore they do not have to undergo quarantine. Next. The last row. I'm from AM 730. All right, for the 3 cases in the same family, did they come into contact with the students in Yaotong? And what about the other family member? I'm referring to the Coral Court case. So was she the mother who has not been confirmed? And also for the 5 in Tai Hang, well, does that include the husband who would go out? So can you provide further details about those? And also for the Pakistani woman, and also for the handing over of the small girl. So can you give us the details? And also for the pet shop sales. All right, for the pet animals, have you said yesterday that you'll be checking out where they're from. So have you found out today? Well, I haven't got the details of the 9 preliminary positive cases details. Well, including the husband and also the 4 children and also another family or household. But then that did not include that kid who was accompanying her when she came back. As far as I know, well, before she left the hotel, she handed over the kid to her family member, and then she went into quarantine. But then for the other family members, they did meet and seen one another. For the pet shop sales, we are conducting a comprehensive investigation, including whether or not the pet animals might have been infected, and whether or not they might have infected humans and so on. And then we understand that most of the pet animals were from Netherlands. But then we will have to wait until the results of the testing are out, including the environmental samples and also the pet animals testing and so on. Okay. In fact, they are from the same family. It's just that there's another household in Yaotong. That's the reason why the student mainly stays there. And then after detailed questioning, the student also did go back to Coral Court. So very rarely would he stay overnight. But then Coral Court's entire family would have to go through quarantine mandatorily. But then her family members also did go to Yaotong to help with the cleaning. And then 12913, before she was confirmed, she did go to this household to stay for a while. All right, next, please. I'm from Mingpao Daily. I'd like to know a bit more about what you said. You said that you didn't know that 12913 had anything to do with the 46-year-old foreign domestic helper. So for the 12913, so was it that she did not report about this visit? And also, she also had close contacts staying in the community without being tested. So could that be the case that that's the reason why we had this chain of infection? And also for the pet shop sales, you said that the whole genome sequencing had something to do with the Pakistani male arriving in Hong Kong earlier on. But then what about the case number of that Pakistani male? And also for the tracking and tracing of those asymptomatic cases and also symptomatic cases, what about the incubation period? For the Maple Garden case, all right, for the carpenter, he developed symptoms on the 9th of January. So what about the incubation period? Could he be infected from the 5th to the 8th? So to what extent will you be tracking down to those who had contacted with him?
When investigating case 12913, we did not get that piece of information. Even when we investigated case 13014, that information was not sure yet. Now we get a clearer picture about the case. If we find anyone deliberately withholding information, causing delay to implementation of public health measures, we will see whether legal actions will be taken. The poly-U genome sequencing, there was a case at 12567. He also carries a delta AY127. However, this case genome sequencing is very different from that case. So she was not infected by the other case. It's just that her genome sequence is similar to the virus in that place. For most of the recent cases, we know the source. For example, on the 3rd of January, someone ate at Nabe Urawa and then he was infected. Then, when we trace the cases, we won't trace those who were at the restaurant before the 3rd of January. We would trace a little further than that before we previously. Now, if we know the exact date where a patient has been to some place, we won't trace anyone who was at the place before that time frame.
HK. So what kind of difficulties are the authorities facing in identifying the source of infection of the pet shop worker? And also for the Pakistani woman, how did she infect the other family? Thank you.
The pet shop sales is still an unlinked locally acquired infection. So we are tracing all the possibilities to try to find out the possible sources of infection, but we do not have an exact cause at the moment. For the 13045, she had a travel collateral coming together with her and staying in the same designated quarantine hotel during the quarantine period. So after she's released from the quarantine hotel, her companion, there's a family to pick up the companion before she left to go back to her own house. So she met the family during that occasion. Yeah, so it is possible that during that occasion, the family got infected.
Next question, the lady in black.
Afternoon from the SCMP. So do the environmental samples collected from the Silka Hotel, do they sort of prove the theory that Professor Yun and other staff at the CHP came up with to explain the transmission there? Second is, do you know the whereabouts of the Pakistani woman's family after they were quarantined, as well as the ones that she came in contact with? And have there been any close contacts of the pet shop saleswoman that tested positive, and have the pets at the store been tested? Thank you.
So I understand we took more than 60 environmental samples from the hotel environment, and so far some of the results came back and turned positive, including the purifier outside the room, and also some air exhaust vent in the toilet. So these places are not those places that are commonly touched by people. So this confirmed that the virus exists. They can exist through the air. They can transmit through the air. Yeah, at least they are found in those air purifiers and air ventilations. For the Pakistani woman who was confirmed on day 26, there are quite a number of close contacts who are confirmed positive. Preliminary positive. So we are tracing their close contacts and whereabouts to try to stop further transmission in that chain. We went to the pet shop together with the AFCD to collect some pet samples from the animals as well as from the environment to try to find out if there is any possible sources or explanations.
Next question, please. The gentleman at the back. Good afternoon, Oriental Daily. Now, the confirmed case at the quarantine hotel, it is said that the air exchange rate of the air purifier is below the standard. So should there be a guideline requiring the number of air exchange and the brand of the air purifiers? This is not the first time we have seen infections in a quarantine hotel. So is there a loophole? Most cases are at the Hong Kong Island. So would you consider asking everyone, subjecting every resident in the Hong Kong Island to undergo testing like that in Tuen Mun? The current guideline is there should be a air purifier in every room in quarantine hotels. That's for curbing transmission of the virus. If the virus is airborne, then it is very difficult to control. Whether there should be other testing regime, it depends on the developments of the pandemic. Next question, the lady in the third row. Good afternoon, I'm from Point News. About the Causeway Bay Pet Shop, the sales lady is infected with Delta. Now we still have the Omicron raging in Hong Kong. Does it mean that Hong Kong is being assaulted by two viruses at the same time? And what will the Department of Health do to deal with these two viruses? We have infected patients carrying both strains, and we have one untraceable case so far. So it may mean that there are two transmission chains in the community. That's why we are doing compulsory testing. Those who have been to places where patients were present have to be tested. If you have symptoms, if you have been to high-risk places, and if you get a ping from the Leave Home Safe app, please go to get a test as soon as possible and don't delay. Good afternoon, Hong Kong Economic Times. Tutorial school. It seems that we can't find it. Can you tell us the address? The family confirmed today. Is it the 71-year-old grandmother from North Point? Did she go to the male students' home at Yau Tong, or did they both go to the Coral Court and then there is an outbreak from that family? Can you give us an exact date when they went to Coral Court, causing the infection? And also the mother from the Coral Court family, what about her activities? And also the building at Yanzhou Street, is that an old building? So are you worried about an outbreak at Yanzhou Street? Tutorial school, that's KidSmart at 171 to 173 Lockhart Road, 3rd floor. According to your understanding, 12913 didn't go to Yau Tong. However, she went to Coral Court at North Point. 13014 also went to Coral Court for dinner.
There's a chance that her domestic helper 13053 might have met 12913, and therefore there might have been some family a within family transmission, and she did go to the Yao Tong family or household to help with cleaning. And what about the case in Yun Chao Street? Well, for the Yun Chao Street case, we also need to take a look at the testing results. For the prelim case involving the mom of a family, I think on the 9th, she did go to the Yao Tong household on the 10th and 11th too. And then she did the testing on the 9th, and then on the 9th, she went to Yao Tong as well. And then most of the rest of the time, she was mainly staying home. Okay, if there are no further questions, then it's the end of the PC today. Thank you.